A multinational trial of Presugrel for sickle cell Vaso-Occlusive events. Definition: sickle cell anemia is an inherited blood disorder that is characterized by painful vaso-occlusive crises for which there are few treatment options.
Sickle cell disease is a blood disorder that is inherited from both parents. This disorder is more common in certain ethnic groups, such as African Americans, Arabs, Greeks, Italians, Latin, and Native Americans. Normal red blood cells are very flexible and are circular in shape, resembling a donut. Their flexibility and shape allow them to travel freely through small blood vessels called capillaries. In persons with sickle cell disease, the red blood cells become crescent or sickle-shaped and also become inflexible. The abnormal cells stick inside the capillaries, blocking blood flow to vital organs. Persons with sickle cell anemia can have symptoms such as yellow-appearing eyes and skin, pale skin, delayed growth, bone and joint pain, increased risk for infections, development of leg ulcers, eye damage, anemia, and damage to the organs affected by the obstruction.
Application in medicine. Children and adolescents through 17 years of age with sickle cell anemia were randomly assigned to receive oral Presugrel or placebo for 9 to 24 months. The primary endpoint was the rate of vaso-occlusive crisis, a composite of painful crisis or acute chest syndrome. Pros and cons. The safety and points include the frequency of bleeding events requiring medical intervention of hemorrhagic and non-hemorrhagic adverse events that occur while patients were taking Presugrel or placebo, and of discontinuation due to Presugrel or placebo did not differ significantly between the groups.
A vaso-occlusive crisis is a common painful complication of sickle cell anemia in adolescents and adults. Sickle cell anemia, most common in those of African, Hispanic, and Mediterranean origin, leads to sickle cell crisis when the circulation of blood vessels is obstructed by sickled red blood cells, causing ischemic injuries. The most common complaint is of pain, and recurrent episodes may cause irreversible organ damage. One of the most severe forms is the acute chest syndrome, which occurs as a result of infarction of the lung parenchyma. Other types of vaso-occlusive crisis in sickle cell anemia include dactylitis, priapism, abdominal pain, and jaundice.
Issue in Ecuador. A total of 341 patients underwent randomization at 51 sites in 13 countries. The rate of vaso-occlusive crisis event per person year was 2:30 in the Presugrel group and 2:77 in the placebo group.
Athletes with sickle cell trait have special considerations before and during their workout. Athletes can unknowingly predispose themselves to exertional sickling by beginning exercise without proper hydration, while physically exhausted, overheated, or while fighting off illness. Athletes with any of these risk factors should be encouraged to sit out or perform a reduced workout. Red blood cells deliver oxygen to the body's tissues through the circulatory system. The cells are disc-shaped and flexible and can squeeze into small capillaries. During regulated physical exercise, the red blood cells in an athlete with sickle cell trait can deliver oxygen normally. Under stress from intense physical exertion, the red blood cells in an athlete with sickle cell trait can no longer hold on to oxygen. These blood cells change from their flexible disc shape to a rigid sickle shape.
Conclusion. Among children and adolescents with sickle cell anemia, the rate of vaso-occlusive crisis was not significantly lower among those who received Presugrel than among those who received placebo. There were no significant between-group difference in the safety findings.
These are normal red blood cells. They're soft, smooth, and round, and can easily move through the body. They contain a protein called hemoglobin, which is responsible for carrying oxygen from your lungs to all the tissues in your body. So, we all have two sets of every gene in our body, one from each parent. People with sickle cell trait have one gene that makes sickle hemoglobin and one gene that makes normal hemoglobin. People with sickle cell disease receive the sickle cell gene from both parents. They have more complications because they don't have any normal hemoglobin.
It is important to note that everyone who is here today has sickle cell trait, not sickle cell disease.
It is also important to point out that sickle cell trait does not turn into sickle cell disease. Sickle cell trait is a common condition. It mainly affects people of African descent, but it can occur in any other person as well. About 1% of basic military trainees test positive for sickle cell trait. Do you want to be a parent someday?
Thank you.